Hello and welcome. I'm Neha Dangayich. I'm on the designated neuroscience seat for the Society of Critical Care Medicine, and I'm here with Marie.
I am the designated internal medicine representative on council.
Thank you. My name is Jose Diaz-Gomez. I'm the current treasurer for the Society of Critical Care Medicine.
It's so great to have both of you. We're going to be talking about a very exciting program that SCCM has just launched, the Centers of Excellence program. So Jose and Marie, could you tell us a little bit about what this program is?
Sure. So this is a program that was created to foster and provide a path to ICU excellence using standby or trusted QI initiatives from the Society of Critical Care Medicine. It's a very exciting program. We've had these QI initiatives in place for some time. Specifically, the ICU Liberation Bundle is what we're beginning with. But the plan is to use future QI initiatives as well.
I do agree, Marie. The program has three specific components. The first component is the education. The second component is the implementation. And the third is actually the new one, which is data tracking and data sharing and the compliance component of that. So now we have researchers and we have implementation scientists and we have educators all coming together with a unique interprofessional collaboration that this society embodies, and that's the real strength.
Oh, that's fantastic. So it's really going to leverage everything awesome about this multi-professional nature of what brings SCCM, this special quality, and brings all these people together. So what would you say is the distinguishing feature of this program as compared to SCCM's other quality improvement programs?
When we talk about multi-professional program, we as physicians always think, well, it's physicians and nurses and respiratory therapists, and all of those people will be included in this. But it's also content experts and data interpretation experts. It's also quite collaborative. So you're not only talking about collaboration within the team of the ICU, but collaboration with other organizations. And that's something very different that we really haven't explored as well in SCCM, is working with other ICUs and other organizations to learn and to see how other people are doing it.
I will add that definitively that data dashboards that we're going to implement, it will make more actionable steps for all these institutions that are participating, and it will be much easier to follow continuously those quality improvement initiatives and then identifying in real time the gaps. And in that way, I'm seeing that as a very different program that we used to have, where we just deployed a program for 6 months and then we'll see. But now we are creating a real sustainability and quality improvement coming out of the SCCM.
I think that's an important point to mention and to reiterate, is the sustainability. The ability not to only look at gaps and deficiencies, but to see what you're doing correctly as well. So you're able to see your progress in real time. And as you say, you can identify gaps and deficiencies and work on them in real time. And that's a unique approach to looking at QI initiatives, which, as you said, usually are sort of short-term initiatives. Here we're talking about long-term improvements in one's ICU and their, measurable outcomes. So it's a very different and unique program from what we've been accustomed to.
I have to reiterate something that we haven't touched yet, which is we are including pediatric and adult.
Oh, yeah, very good point, right? Pediatrics and adults. So it sounds like a really comprehensive template for covering that entire spectrum, from quality improvement to clinical care to team building to research. You're also creating a learning community, right, with all of these different organizations and hospitals and health systems coming together, implementing quality improvement initiatives, getting real-time feedback, and you're guiding them with all this data.
I think that this program has become extremely popular. Just such a short-term program. We've just introduced it not too long ago. But Think about the issues that ICUs are facing now. They're facing problems with staffing, right? They're facing problems with ICU burnout. They're facing problems and pressure from many different regulatory agencies, such as the Joint Commission, the hospital itself, from patients and families, to produce data that show that ICU outcomes are better. So there's a lot of pressure on ICUs and hospitals now. And I think what this program does is it offers them support in terms of educational support, data implementation support. It offers them structure. It offers them a path to improving their outcomes. You know, initially we're looking at data acquisition and implementation outcomes, but eventually in the phase 2, we're going to be looking at patient outcomes. And I think that is so important. And also there's a sense of pride and recognition that, you know, you're an ICU center of excellence.
We are facilitating something really unique, which is demonstrating to those institutions that their own people are really valuable.
It sounds so wonderful that you're providing an avenue for the local organizations, hospitals, health systems to recognize their ICU teams, to recognize their value, and to get this commitment from their own leadership to become a center of excellence. So it's such a unique opportunity, both for the local organization and then for SCCM to serve as this facilitator. This ICU Centers of Excellence program is really meant to uplift that multi-professional community, which is very much in line with the ethos and vision of SCCM. Thank you so much, Marie and Jose. It's been so wonderful talking to you.
Thank you.
Thank you.